Matters with Dr. John Darcy.
Now, before the break, Katie, we were talking about Rod Gonfire. Now, Rod was snoring so much and getting sleep apnea, which was so bad that he'd fall asleep in his car at the traffic lights. And the problem started to affect his marriage when he had to sleep in a separate room to his wife.
Yeah, and I reckon that's pretty common, Doc. And thanks to a new device called the EPAP, Rod is now sleeping soundly and his life is back to normal.
And to explain how the device works, we're joined by sleep expert Dr. John Corbett up on the Gold Coast. G'day, John.
Hello, good to meet.
Hey, listen, it's a common thing, sleep apnea, is it not?
Oh, terribly common. It affects roughly about 20% of the population. And the real problem is that 80% of people who have the problem don't know they have it. The reason is that we breathe in through a soft, floppy airway at the back of the throat, and when we're asleep, all the muscles relax, the airway collapses, then we try to suck air in as the diaphragm works, and it sucks the sides together. When that happens, it's a bit like you're suffocated or choked. There's no oxygen coming in, oxygen level falls down, and that's very bad for you.
So snoring is not just the issue, there's this absolutely huge health issue as well.
Absolutely. Any condition in the heart is made worse by sleep apnea. Diabetes is made a lot worse. But above all, quality of life is just ruined. But, you know, there's a study that came out, or two studies really, in the past month, indicating that sleep apnea might very well also be a cause of cancer. It looks like it puts the risk up by a factor of 2 to 5.
Wow.
So it's just, you know, one of these things that we have to take very seriously. And when we're talking to Rod, he explained to us that he's using this EPAP machine. Can you explain to us what that is?
The most common treatment, let me go back a little, is CPAP, called continuous positive airway pressure. And that works by a patient having a machine which pumps air into the pressure, and that stops the airway collapse that I was talking about a little while ago.
Yes.
That positive pressure holds the airway open like a splint. Now, the usual method is having an external machine provide pressured air. But a group in the USA came up with a really interesting new idea where they depend upon the pressure generated by the patient.
Right.
So for someone breathing out through their nose, what they came up with is an idea where if they block the air outflow,
yes,
then the positive pressure that's naturally generated by the patient as they're forcing air out is enough to hold the airway open.
Wow.
So the concept is identical. It's a positive airway pressure to splint the airway open, but in this case it's generated by the patient. Now, it's a very simple device, a couple of little adhesive devices which stick on the end of the nose, one on each nostril, and it has a flap valve on each side so that the valve opens when the patient or the wearer breathes in through the nose. But when they try to breathe out, there's only a small exit hole. So they, instead of breathing out at a rapid rate, they breathe out more slowly, and the pressure builds up behind that little flap valve that's in the nose, transfers back into the airway, and that splits it open.
Now, John,
very clever device.
John, there's a lot of people out there who do snore, who realise they snore, or whose partners realise they snore. What should people do if they think they've got a problem with sleep and with snoring?
They need to go to their GP, they need to obtain a referral and be sent along for a proper sleep study. Then, if they do have sleep apnea, then it needs to be treated because most of the problems, health problems, which come from failure to treat are curable and preventable. So the answer is very simple. Go to the GP, obtain a referral, go to a sleep physician or a sleep centre and have a proper study done.
John Corbett, thank you so much. There are so many people who will benefit from hearing your discussion about this. Thank you so much for joining us on Health Matters.
Thanks, Dr. Corbett.
For more information about the EPAP device, talk to your general practitioner.
After the break, the key ingredients for a healthy seed.
102.3
Audio.